Hello everyone, I am Dr. Kanupriya Jain. I am an obstetrician and gynecologist working as a consultant at Cloudnine Hospital, Ludhiana. Systemic lupus erythematosus is a condition where there is autoimmune reaction to different parts of the human body. It may affect one organ or multiple organs at the same time. So it usually affects young women. It is a systemic condition. So women who are suffering from lupus must have a planned pregnancy. So lupus has far-reaching consequences for a pregnancy, not just the disease but the treatment. The cytotoxic drugs that are given during lupus treatment may have a lot of implications for the mother as well as for the baby. So a woman who has been diagnosed with lupus must first consult her rheumatologist and continue her treatment till she is in remission. And then once she is in disease remission, she can plan a pregnancy. But then this is always going to be a high-risk pregnancy. She may have a flare-up during pregnancy as well. She must be on minimum number of drugs, and all cytotoxic drugs should be avoided before the pregnancy is planned. And once she is pregnant, she should be looked after a multidisciplinary team, which should have a rheumatologist, a nephrologist, an obstetrician and pediatrician who will be taking care about all aspects of the pregnancy. These patients have to be very closely monitored, and they should be delivered in a tertiary hospital. Most of them will require blood thinners or drugs which decrease the hypercoagulability of blood throughout their pregnancy, and so they need extra monitoring for that as well. And their kidneys and the other organs which are affected in that particular patient also need monitoring. So fetal monitoring is also very important. The baby may develop growth restriction. There is a possibility of abruption, or there is a possibility of intrauterine death also. So they are very closely monitored and delivered also usually earlier than the usual 40 weeks of gestation. So every case is different and needs individual care, but they need very close tertiary care support whenever you have a lupus mother. And the babies also will need neonatal care after delivery, because the babies when they are delivered may have some symptoms because of the antibodies that they may have gained, and so babies also need good NICU setup for immediate care after delivery.